Hi, my name is Lilian Abrahams, and today I'm going to be talking about narrative therapy. Narrative therapy was coined or developed by David Epstein and Michael White. When I think of narrative therapy, I think of stories. Stories we tell ourselves about ourselves. Think of it as a narrator, someone telling a story. And I see myself as the privileged audience, the listener, the one that is witnessing the story that is being told by the individual or the couple or the family or the child. So narrative therapy can be used with individuals, it can be used in family therapy, it can be used with children. How does it work? It works through a process of externalization. So think about external and internal. Instead of internalizing the problem, we externalize it. We put it outside the individual, outside the family. So, for example, I may ask a question about when we first noticed it, what happens, and I might think about together with the family or the individual of the couple or with the couple, think about a name we want to give the problem. So we give the the problem a name. So for example, it could be anxiety, it could be self-doubt, whatever name it is, whatever it is that brought you to therapy, we think about it together. And through that process, we then start to work together. We think about the past moments, the stories you've been telling yourself about the past, and what alternative stories can we find? So we work together to find links between past and present moment, but the goal is towards finding alternative stories through knowing within ourselves that we have the resourcefulness within us, the richness of stories. There are always alternative way of being. There's always another way. There's always another story. Thinking about the values the individual plays within themselves. So we think about values, beliefs, strengths, and then strengthen those stories that are told. Find alternative ways, alternative stories that will bring about change and healing within the individual. So really, in a nutshell, that's what narrative therapy is. So think about, we externalize, we separate the individual or the family from the problem. We find skills within the individual, within the family, that can help them to resolve the problem or whatever they came with, and find alternative story. And yeah, so that's what narrative therapy is. And thank you for listening.